Good morning, everybody. I have nothing to disclose, so you can just go through the next few slides of the disclosures. And I think we can go to the objectives. So the talk today is about anxiety and stress in the context of COVID-19, with the focus on healthcare workers and long-term care. And there are some concepts that I think will maybe provide a lens through which to explore anxiety and stress. And then I'm going to end with a discussion of some resources that hopefully will help enhance coping. So this Angus Reid poll was done and reported in CBC Online on April the 27th. And Canadians were asked to describe how they'd been feeling in recent weeks. And in the recent weeks before the poll, and 44% described feeling worried, and 41% said they'd been anxious, although 1/3 did say they were grateful. So keep that concept in mind for later. Half of Canadians reported a worsening of their mental health since the shutdown had begun. So the talk and the focus is on us. So how do you think the mental health of healthcare providers, and here I'm referring not just to nurses and physicians and social workers, but also directors of care and administrators and managers, how do you think it compares to the general public? So maybe for the poll, do you think that healthcare providers are faring the same, better, or worse than the general public? Yeah, so the sense is that it's a bit tougher for healthcare providers right now, and I think that the evidence that I'm going to show you will support that. And now let's just go to the next one. What about healthcare providers working in long-term care homes, which you know now is the epicenter for COVID-19? And this is just for interest's sake because I don't have the data to really share what's going on other than your own feedback and what you're feeling around you. Okay, so let's go on then. So I'm going to share with you some information and some data. This is a study by Lai et al. That looked at healthcare workers in coronavirus's epicenter in China, and it was cross-sectional. And the outcome measures included the patient health questionnaire, the generalized anxiety disorder scale, the insomnia severity index, and the impact of event scale. And 50% reported symptoms of depression. Rates of anxiety and insomnia were also high, and more than 3/4 of people reported high levels of distress. Now, women, nurses, and those in Wuhan with frontline experience, they were who were providing direct care were the most affected. So what factors do you think make people vulnerable to adverse mental health outcomes in this context? For example, I don't think we did this as a polling question, so just for reflection, does age or gender or profession affect impact? This was one study. So last week I attended a webinar done by Doctors Crawford and Sokolingam, who are our colleagues with ECHO Mental Health. And they had shared some data from a survey they did of their participants from their ECHO run through CAMH. And they asked physicians, nurses, and social workers and other counselors a series of questions. And they asked them how much they agreed with a certain statement. And these are the ones that had the highest agreement scores by percentage. So again, you could see work is a very stressful place right now. Sporthy reviewed 6 papers, actually, all pertaining to COVID-19, so really hot off the press, and found a higher these studies find, in general, a higher symptom burden among nursing staff. And that's because nurses are directly involved in care. That's one reason. They probably have less autonomy, for example, than physicians. Here I am working at home today, and nurses often usually can't do that. But we can also learn from the experiences of SARS, and it's interesting that in a study there, single physicians were actually at greater risk than married nurses. So there's something about that. It's about maybe one sense of isolation or connection. And also, there are some differences now between COVID-19 and SARS, even though we could look at that data. I was in quarantine during SARS because my spouse had it. And at the time, there was no Netflix. The internet wasn't what it was today. And I had a sense of not really knowing what was going to happen. And I looked at the news a lot now. I look at the news a lot now. I check it regularly. I use Twitter to stay in touch. And Now we have a lot more global connectedness, and that means you could watch CNN or Fox 24 hours a day. And there are some downsides, and there have been studies actually not in the context of COVID-19, but in other disasters that show that looking at the news can actually heighten anxiety. And I wonder what the policies are in long-term care homes if people are sitting in front of the TV watching CNN, and how that's affecting people as well. Apart from SARS, I'm finding it interesting to compare COVID-19 to previous pandemics like the Spanish flu. And here's a picture of somebody wearing a mask. And now you can order them online, and you can have different designs. This one's by Gucci, that's Billie Eilish. I'm not sure that this is an effective barrier. It looks kind of flimsy, but next study is looking at overall sources of stress. So the study so far suggests that the stress for healthcare providers is due to, and this is pretty logical, and I ask you to also reflect on your own experiences and feelings. So fears of running out of PPE, maybe that's improved a little bit, but lacking training in their usage. And of course, fear of getting sick and great stress when you're in, you get that call, so-and-so on the unit may have been infected. And so certainly that's a factor. And I put that star there because there's also something about vicarious trauma. So even if you're not in direct contact, your stress can still be quite high. So we're also stressed about keeping our clients safe and about their families and their anxieties. We're worried about our colleagues, and when colleagues stay home or for whatever reason, that also contributes to burnout. And we're all worried about bringing the illness home, I imagine. It's also the symptoms of COVID-19 themselves are so unpredictable. Who gets critically ill and who's going to be an asymptomatic carrier? And the manifestations are also all over the map. There are, reports of stroke and renal failure and encephalitis. There's uncertainty about, as things open up, is there going to be a second wave? Is there a vaccine? Is there going to be a treatment to mitigate these symptoms? Financial stress, the whole topic right there. People that have pre-existing mental health issues, because all of us, we're humans too, and we can have other issues. And, being quarantined, by the way, that can have a psychological impact when you have to stay home in quarantine. And this is a paper from the Lancet that found that people can have post-traumatic stress symptoms and fear and anger. The point is that being a frontline care provider does not inoculate you against other forms of stress in our society. And this is from the Canadian Women's Foundation. It's encouraging people that are in abusive situations at home to use the Signal and video calls. I don't know if you've heard about that. If they're on Zoom and they want to share that. And certainly all of us are vulnerable, like everybody else, to substance abuse, which is certainly on the uptick right now. So what helps? The feeling that one's loved ones are safe, having a strong social support network, that's a theme that's going to run through this talk, a sense of social connectedness. And you can be at home alone and still feel quite connected virtually. Feeling also appreciated, that's been reported, a sense that, society at large values what you're doing. The banging of the pots, that's like so moving when you hear that, I think. Having access to help if you need it, and clear communication, clear policies, knowing, even if there are unknowns, having it clearly communicated. The themes of wellness, I think everybody knows this, and I'm going to move on because I want to share. Humor is an important aspect, so I that's my sense of humor. Okay, so in COVID-19 and its impact on mental health can be seen through different lenses. And what I want to do in this portion of the talk is to really go over some of the lenses that I think are relevant. And grief is one particular one, because if you think about the losses, financial and professional, loss of freedom of movement, watching residents potentially die in long-term care, yourselves not being able to visit a loved one, watching people that are ill pass away, all of this can lead to sudden, unexpected loss, not being able to mourn ritually. And all of this will ultimately increase people's risk to long-term complications that we'll ultimately see. And this is a concept that helps maybe in a way in how we can accommodate to the pandemic. Initially, grief, for example, is all-consuming. And over time, it's still there, but the world grows around it. And hopefully that's something that's going to happen with the pandemic. Gratitude is the appreciation of what is valuable and meaningful to oneself. It's a general state of thankfulness and or appreciation. And this is a hot area of research. We can talk about, I actually just read the abstract because it was Spanish. It would look like a great paper. So I won't spend too much time on it. But you can measure gratitude. Because what I want to do, there are gratitude exercises, but just for a minute, in keeping with the time that we have, I want to ask, what are you grateful for? If we could do that. I'm going to share, I'm grateful that I'm not homeless and all the big things, but in small kind of funny ways. I play Rummy Cue every night with my family, doing jigsaw puzzles, less traffic. I get to see celebrities' rooms. That's kind of neat when they're virtual. Those are just some things I thought of. Virtual exercise classes. That's amazing too. Great. Netflix, yes. More time to watch Netflix, maybe. I mean, a lot of us are working, so we don't necessarily have the time, but if I like wearing sweatpants when I'm doing Zoom calls. That's my favorite one. Thanks for sharing that. We can put that up in our, with the, when we disseminate it. So another lens that we can understand COVID-19 is through the lens of resilience. And so we know that stress activates the HPA and cortisol is released. It peaks within about a half an hour. But when you have prolonged exposure to a stressor, like say a pandemic, this can lead to chronic stress. And some people, though, cope better. They're more resilient. So factors that seem to be associated with resilience and the ability to manage stress, that includes optimism, having a flexible cognitive style, and for some, religion, for others, spirituality, which can mean communing with nature too, enjoying the sunshine, the ability to find meaning in life, and again, social support. These are factors that moderate the impact of stress and anxiety. Being able to manage stress and distress can also be interpreted through the lens of trauma, and specifically how one overcomes it. And Dr. Bruce Perry is a noted trauma expert who talks about stress in a series of videos that I've shared here, the links to, and he also has a conversation with Oprah about the pandemic. This concept, in the process of struggling through loss or trauma, it's also important to know that growth can occur. It may not feel like it at the time, and people describe ultimately having a greater appreciation for relationships and priorities in life. And it's often something that you don't see until after, but I promise that this is something that you can take stock of. It just might not be apparent now, but it is an area of research if you're interested. So in the final 5 minutes or so, I want to just go into some tools. So Folkman and Greer wrote about coping with stress and anxiety in the context of serious illness like cancer. And they described 3 different types of coping, depending on whether the situation is under your control or not. And my colleagues, Doctors Hunter and Maunder at Mount Sinai, put together this short YouTube video that really explains this well, and they compare it to COVID-19. So I'm just going to distill for a minute a little bit about that. So a problem could be something like things that you can control, problem-focused coping. So you can get more education on the use of PPE and find out about the policies and COVID-19. But the emotions that they wash over you, you can't control. So what can you do about it? Maintain your sense of humor, employ all those wellness things, support others. And when you can't do anything about it, you have to find a way to live with and in spite of the suffering that you're experiencing. And that's things like finding value in your work and your purpose and all that. So the other thing, awareness of the cognitive triad can also be a tool that can help you gain understanding of what's going on. So, so we're anxious, and if you have a thought that you're going to get sick, an anxious thought, for example, you can become afraid, and then you could be worried, so worried that you check, as a behavior, your action will be you're going to be checking your temperature or going and seeking reassurance. And you have to maybe intervene and be aware of that. And it's really okay to experience the anxiety and let it wash over you, because when you avoid it, that's really bad. And how can you kind of metabolize the anxiety? So the tool of box breathing is very simple. You breathe in for a count of 4, you hold it for a count of 4, you breathe out for a count of 4, and then you hold it again. And This is a way of resetting the autonomic nervous system to kind of take away from that sympathetic surge and move to the parasympathetic one. And it really does work. Long out breaths also work really well. Not the like deep in breaths, like, but like, you can try that. You could even say something like "voo." Sounds funny, but it works. Voo. And I've seen that work right in my office. So these are some breathing practices from Dr. Richard Brown that are short and helpful. And then I'm not doing the mindfulness thing where I'm going to get you to eat a chocolate. So what I will share with you, that you can go and find these excellent resources and some really great apps. I've looked at the Insight Timer, and the recommendations come from the Oxford Mindfulness site, which is highly recommended, including by our own Janet Murchison here, who runs our mindfulness program. The International Psychogeriatric Association has specific resources and topics of relevance to long-term care settings, and you could go there, and I recommend that site as well. And for the last minute or two of my talk, I want to focus in the next minute or two on stigma. So if not now, maybe later, you might very well encounter stigma. And it's bad enough being denied entry into a bank. Or actually, after my SARS experience, I was at a video store and I had my videos ready to go. It's dating me, but and I was like, oh yeah, and my partner's still in quarantine. Oh, sorry, you can't rent them, and they took it back. I remember there had to be a special meeting before I came back to work too. People were a little anxious about me being there. It's a bit different now because we're in this large cohort of people all experiencing it, but it is possible that that's going to be a factor down the road. But we also internalize stigma, and beyond relaxation and mindfulness, you may have a need to seek mental health support. So that's the resources. That's just, we're anxious, but when there's something deeper going on and you're depressed or you're not able to cope and it's so overwhelming and you can't distract yourself with Netflix, there is so much help out there right now. It's not, the challenge is not in where to get the help, it's in asking for it and being able to ask for it. So I want to end with this slide. Dr. Laura Breen, who is an emergency physician in New York City, as you probably all know, committed suicide. She took her own life. She'd had COVID-19, but was an active frontline healthcare worker, and she wasn't able to ask for help. So I just want to say, if you need it, it's there, and please ask for it. And thank you.